Hello, today I want to talk to you about the Patient Bill of Rights. I've brought in Dr. Jake to assist me.
It's a pleasure to be here.
Pleasure to have you here, Doctor. Let's get started then. We have human rights and duties. A patient in the hospital has a set of rights and duties to perform.
Of course, the staff as providers of medical services have rights and responsibilities as well.
Let's start. First is access to information in general. After this, the first thing we will look at is access to information. There's a right to access all relevant information about everything concerning them. A patient has the right to access all relevant information concerning themselves, from diagnosis, treatment, prognosis to all possible outcomes in a language he or she understands. The right to fully participate in the treatment. The patient has the right to participate in things like the implementing of their treatment plan and making decisions along the way. Also, the right to patient-related information. The right to access records. A patient has the right to access records, including information about range and scope of available services. The patient has the right to access record of treating professionals and care.
Patients have the right to request and access the record of their identity, skills, and credentials of treating professionals and healthcare providers. Miss, my name is Dr. Jake, and I will be in charge of your treatment. A patient has the right to full estimation of costs, transparent and itemized billing.
The patient has the right to have full disclosure of the cost of treatment or estimation of recommended treatment plan and services. It is also entitled to itemized and transparent billing. It has the right to privacy and confidentiality. Confidentiality and privacy of all information and medical records. This is an important patient right, and it must be upheld at all times unless disclosure is vital and in the interest of public health. Of course, it must be in accordance with prevailing law. The patient has right to quality of care, access to clean, safe and secure healthcare environment, and access to equitable quality care and caregiving. A patient also has the right to have access to a clean and safe and secure healthcare service, the right to equitable quality care and caregivers irrespective of their ability. A patient has a right to their dignity, to be treated with respect and dignity without prejudice. Prior wishes of the patient, or in the absence of the patient, wishes of their next of kin should be respected.
A patient has the right to be treated with respect and dignity without prejudice to gender, religion, race, ethnicity, allegations of crime, geographical location, disability or socio-economic circumstances. Also, prior wishes of the patient, or in his or her absence, the next of kin, where legally applicable, are to be respected to the fullest extent practicable at the time of the death of the patient, including cultural or religious preferences to the extent it is consistent with extant law.
Access to emergency care. The right to receive urgent, immediate, and sufficient intervention and care in the event of an emergency. A patient has the right to receive urgent, immediate, and sufficient intervention in the event of an emergency, prioritizing needed attention over others, such as cost and payment, as well as law enforcement requirements. It has a right to receive visitors, different purposes. That is, according to the rules of the facility, of course, and also refuse care. They have a right to retain control of their person and must be informed of their right to decline care. They have the right to consent or decline participation in medical research, experimental procedures, or clinical. A patient retains control of their person and must be informed of their power. This power includes to decline upon full disclosure of the consequences of their decision. Patients have the right to consent or decline participation in medical research, experimental procedures, or clinical trials. Interruption of service by providers. The patient has a right to be informed about impending interruption or disengagement of service of primary or attending professionals responsible for their care, to methodical and practical transition of treatment for patient safety and continuity.
It is the right of the patient to be informed about impending interruption of primary or attending professionals responsible for patients' care. They are also entitled to methodical and practical transition of treatment for patient safety and continuity of care.
Has rights to complaints, the right to express dissatisfaction of services or providers. Under the patient's rights concerning complaints, a patient has a right to complain about the services or any provider, including personal changes and. Now let's take a look at patient's responsibilities. So far we've looked at different sets of rights a patient has, and now it's time to look at what the responsibilities are. Number 1, access to information. A patient has the responsibility of seeking information from caregivers about their services and a duty to understand their own treatment plan. The patient has the duty of access to information to provide details about any changes occurring during or on account of the treatment. A duty to report dissatisfaction through appropriate channels provided by the facility. The patient has a duty to request information about range and scope of available services, including the identity, skills, and credentials of treating professionals and care providers. The patient has a duty to pay bills or make provisions for the prompt payment of bills. In the event of an emergency, the patient should demonstrate ability and intention to pay. Ability of confidentiality. A patient has a duty to completely, truthfully, and accurately disclose medical history, medication, and complaints. The responsibility to give explanations during treatment where necessary. A duty to not to constitute a nuisance or in any way endanger others. A duty to respect and consider the rights of other patients, and a duty to conduct all interactions with consideration and respect for others.
It is the patient's responsibility to recognize that emergency treatment and prioritization do not mean a waive for the obligation to pay for service.
It is the patient's duty to recognize that healthcare facilities are for several people and expected to respect operational rules and regulations for the safety and security of all. Also, the patient's duty to respect the fact that healthcare facilities reserve the right to modify rules to maintain peace and ensure the safety of all. It has to provide reasonable notice of modification, though. It is the responsibility of the patient to comply with rules and regulations of the facility, as well as directives, instructions, and advice of attending professionals. It is the patient's responsibility to inquire about any contingency plan or other suitable alternative with respect to continuing treatment and care. The responsibility of the patient to complain in accordance with the redress mechanism of the facility, as well as provide sufficient details of what dissatisfies him or her. If the patient is still dissatisfied with the outcome, he or she can report to the appropriate regulatory authorities, such as the Medical and Dental Council, and if not satisfied with the Medical and Dental Council's decision, can go on to the Consumer Protection Council. Before now, we have focused on patients. We've learned about their rights and responsibilities, and patients in an healthcare facility. Now it's time to go to provider responsibility. A look at provider responsibility. Provider responsibilities. Dr. Jake, let's do this together.
We have a duty to inform patients about the services available at the facility and their eligibility for these services based on health insurance or out-of-pocket costs and responsibilities. We are to inform patients if the proposed treatment or procedure is still in the experimental stages or part of an ongoing research work. We have a responsibility to answer the patient's questions about the proposed treatments and or procedures and provide information about all potential risks, alternative treatments and or procedures, and to provide the patient's medical records on the patient's requests or on the request of an authorized person. The latter would be in accordance with prevailing laws, of course. In the event of an emergency where the patient is in need of urgent intervention and care, it is our responsibility as healthcare providers to provide such immediately and sufficiently, prioritizing such needed attention over factors including costs and payments. Confidentiality is one of the most important topics when it comes to our responsibility. We have a duty to respect and maintain patients' personal records.
I know that confidentiality is one of the most important topics in healthcare. That is why some patients open up about themselves, trusting that the information is safe with their doctor.
Yes, this also helps recommend a solution more accurately.
I've done my research on the topic, and correct me if I'm wrong. Some of the responsibilities of a healthcare provider includes the responsibility to conspicuously display the scope of practice and available services, and customers' phone number, email address, and any other contact information. A duty to communicate clearly with the patient, including providing translation where there is a language barrier or adaptation in case of disabilities. To ensure that patients demonstrate sufficient understanding of the information provided, as well as provide sufficient identification when on duty, including the display rosters and apparels of practitioners with visible identity tags. Care providers also have a duty to maintain records of personnel's current certificates and their license to practice. Care facilities should maintain a current certificate of standards as evidence of authorization to operate within their approved scope of practice and deliver care that minimizes risk and harm to patients. Facilities should adopt clinical governance standards and provide best care while protecting patients from harm and abuse. It is also the duty of healthcare providers to treat patients, human remains, and tissue samples with care, consideration, and dignity without prejudice to gender, religion, race, ethnicity, geographical location, physical ability, or socioeconomic circumstances. They are to ensure that comprehensive information, guidance, and support to bereaved relatives and prepare remains for viewing at the mortuary room by relatives in compliance with guidelines for last offices unless harmful to public health and to the extent consistent with extant laws including coroner's laws. The duty of healthcare facilities to counsel and encourage patients on the disclosure of disease of public health importance, deadly infectious or non-infectious disease to spouse or close relatives in accordance with public health laws. Facility service is interrupted by the providers. It is their duty to reschedule their patient's appointment, and they are to tender sufficient intervention to inpatients and emergency cases. In regards to complaints, it is the responsibility of the healthcare providers to encourage patients to ask questions about their services, maintain records of complaints, and redress procedures of the facility and address complaints in accordance with the procedure, informing patients at the onset of redress mechanisms that are provided by the facility and regulatory bodies with timelines for action on complaints.
That was all correct, but he left out some points. It is our responsibility to immediately evaluate patients with medical emergencies, including prioritization where necessary, and maintain a sufficiently responsive and efficient 24-hour uninterrupted emergency unit in the facility. It is our duty to inform patients and relatives of visitation rules upon admission and any subsequent modification. It is our duty to recognize that minors, people less than 18 years of age, are under the care of patients or guardians whose consent must be secured in clinical management and procedures to the extent permitted by law. All of our medical research, experimental procedures, and clinical trials must comply with the approved ethical procedures, and we may detain patients in the interest of public health.
Thank you for that, Doctor, and thank you for your time. Thank you everyone for watching. Catch you in our next episode. Bye. Thank you for watching.